everyone. Welcome to Money, Power, and Medicine. I'm your host, Dr. Jennifer Charles. And I kind of want to talk about why I'm doing this episode.
Okay.
I think that there's a lot of specialties in medicine that people don't know about. Everybody knows about a doctor. Everybody knows about a nurse. Everybody knows about a PA, which typically takes a long time. But a lot of people don't know about the different specialties that you can enter that can be just as, if not more lucrative. Right? And it requires less time to do. So I had to bring on one of my favorite surgical technologists onto the show who is just doing her thing, who's super personable, very serious about her work, loves what she does, is excellent at what she does. Miss Gina Davis. Thank you for coming on for a second time because I got perfectionist issues.
Girl, it's okay. I see why. I get it.
So thank you for coming on again.
Thanks for having me again. Anything for you, girl.
So surgical technologist.
Yes.
I guess we'll start talking about what is a surgical technologist.
Yeah.
What do they do?
Okay, so a surgical technologist is someone that's a part of a team inside the operating room. And our job is to solely be in charge of instruments and assist the surgeons in the surgery. So scalpels, scissors, all the instruments you can name of, that's our responsibility. So that's what we do.
What were you doing before you became a surgical technologist?
I was working in a hospital in the food and nutrition department.
Okay.
So I wasn't really doing anything. I went to college 2 years prior to getting that job at the hospital.
So you had your bachelor's?
Associates,
okay.
in sociology, but I didn't really know what I wanted to do with that.
Okay, you're still young.
I was so young, I was 24.
Okay.
I'm 31 now. It's crazy.
You're grown.
I'm getting grown. So, what did I do? So
So you were in the food and nutrition.
I
remember. Is that working in the kitchen?
I was working in the kitchen, girl. Yes.
And I remember you had a girlfriend.
I had a girlfriend. Yes, that was a Haitian queen, my Haitian
Stop
goddess. I love her so much.
Haitians are such a vibe.
I don't know why I gravitate towards you guys. There's something in it. I don't know.
It's the voodoo. Let me stop. Go ahead. I got that. We're gonna clip that.
Anyway, so she was studying surgical technology, and I just so happened to ask her one day, what is this? Put me on, and she put me on.
Okay.
She literally walked me through the entire program and gave me some of her notes and everything.
Okay.
She held my hand through it, and Natalie girl.
I love that about our community. If there are some gatekeepers, I feel like in our community, but I feel like it's to no benefit. Why are you going to gatekeep?
Yes.
I don't get that. So I really love when I see people helping each other and, holding each other's hands and showing them how to do it, encouraging each other because everybody can get to this bag.
And I want to say particularly Haitians that I've come across.
Really?
I don't know. It's something about the Haitians. They don't gatekeep.
No,
they want to see each other do good.
Yeah, you got to see each other do good, right? Because life can be really hard and very challenging. And if there's an opportunity that doesn't really affect me, even if it did affect me hypothetically, if it's meant for you, it's meant for you. And whatever God has in store for me is going to be for me.
Yes,
so surgical technology school.
Yeah.
How long is that?
Well, it depends because they have accelerated programs and then they have a 2-year where you can get a degree.
That's long.
2 years is kind of long now. Right? Long. I feel like the older we get, we're like,
No, but I think the institution, I can never say where I work at because there's so many haters. That could be, I think it's 18 months. 2 years is not bad.
It was 18 months. Yeah.
18 months is really good.
Months, yeah.
And I like the idea of becoming a surgical technologist because one, it doesn't take too long.
Nope. I'm sorry to cut you off. Even 2 years is not that long as opposed to getting 4.
How much is it though per year, hypothetically, if you were to pay it out of pocket?
Well, I guess that depends on the institution.
Okay, but what's the range you've been saying?
I would say the range is you're not going to pay more than $20K though.
$20K a year?
Yeah, for the tuition.
Oh, that's a lot.
Yeah,
I thought it was less. I thought it was $16K.
It depends on the institution.
Okay, so find a cheaper institution.
We're gonna range it. Yeah, find a cheaper one. Find a cheaper one for sure.
What are the courses that are required during surgical technology school?
So for the accelerated program that I did, I think we didn't get the same amount of courses that a school would get, the 2-year would get. So we only got biology, pharmacology, anatomy and physiology. I'm missing something else. So we didn't really get too many courses because it
Okay.
was like 6 months classwork and then 6 months clinical work. So it was really quick.
Okay.
Yeah, I think that we just got the basics down to become a surgical technologist and not like all that
Anatomy,
extra stuff.
physiology,
Biology,
biology.
pharmacology, because you need to learn drugs,
Because some
right?
people don't like science. I know a lot of
Yeah.
people. I'm like, oh, go to nursing school. And they're like, no, I don't like biology. So
Yeah.
this is not for you either. If you don't like biology and
Yes.
anatomy and physiology, you kind of have to
Yes.
have some like gravitation
Yes, you
towards
do
the
have to have some
science.
sort of interest in it. Yeah.
Okay.
And I love anatomy. I'm a little geek for it. I love
Okay.
everything about the human body.
I
Yeah.
love it too. Anatomy was probably like one of my favorite courses during med
Right?
school,
It's
especially doing
fun.
like dissections and
Girl.
cadaver. It's probably a little morbid to talk about,
Yes.
but it's one of my favorite.
The healthcare girls know. They get it.
The healthcare girlies. Okay. So school can be 18 months to 24 months.
Yes, that's right.
But there's a time period where you're actually inside of the OR. Is that included in school?
That's correct. Exactly.
Okay, good.
So that's included in school. Yes, for sure. You have hands-on experience inside the hospital and you are working 8 hours with no pay because you're in school.
Okay.
But you're getting the experience.
So surgical technology. So part of it is book work, and then the
Yes.
other part is clinicals. How long is
Exactly.
clinicals about?
So for me, it was 6 months. So it
Okay.
was 6 months coursework and then 6 months clinical
Clinicals.
work.
In
Yeah.
the OR,
Mhm.
operating room is very different.
Oh, yeah.
It's a different kind of culture in there.
Mhm.
And
Do you love it?
I love being inside the OR, but I'm seasoned,
You're
right? I'm
seasoned.
a seasoned. I'm like a vet. I don't let people play with
How
me in the
many years you been
OR.
in the OR?
Like 7 years.
Oh, yeah, you're
I
seasoned.
do observe, though. I
Mm.
do observe the interactions between everybody because it's a lot of people inside the operating room. So you have your physician who
Mhm.
you're working with, or your surgeon who you work very closely with.
Exactly.
Then there are nurses.
Mhm.
Then there's your anesthesiologist.
Yes.
Then there could be medical students.
Yep.
There could be residents.
Yep.
And then most importantly, the patient.
Oh, yeah.
Okay.
Can't forget the
That's
patient.
the most important person is the patient.
Yeah.
But I remember when I first started rotating as a medical student inside the operating room, surgical technologists could be me. When it came to their surgical
Really?
fields,
Yes.
right? Because it's
Mhm.
your duty and your responsibility to make sure that your surgical field is remains sterile,
Mhm.
right? And you know how to drape and gown.
Absolutely.
Can you talk a little bit about that? Like draping and gowning
Okay.
and your surgical equipment. What does it mean to be sterile? Is it too many questions?
Which one do you want to know first?
Setting up and
Setting
keeping
up.
your field sterile. What
Okay.
is that like?
So yeah, we don't play. We don't play about it. Do you
Infection.
play about your anesthesia area
No,
at
you can't play.
all?
When it comes to patients, you just can't play. Yeah.
So sterility for me is like that. Like if you're coming too close, if you don't know what you're doing, that's my home, that's my field, that's where I work, right?
Yeah.
The nurse had their nurse station.
And the
Even the
equipment is
surgeon has.
expensive. The equipment is expensive. And then sterilization. If you have to, like, there's been situations where cases got delayed because of contamination.
Girl.
Have you ever had that?
That happens a lot often than it should.
What
like.
are you finding that's contaminated within your surgical equipment?
So the thing is that inside of these trays, there are sterile indicators. And some of them, they won't have indicators. So how will we know if something's sterile or not? So we'll have to take that back. Or there's soil, like meaning there's like wetness inside. It has to be dry. So we'll have to send that back in.
Let's go in a little deeper.
Oh, God.
Because I think people don't know.
Oh.
So when you're having surgery,
Okay.
the equipment is reused.
Oh.
I think they don't know. I don't think the average person knows that.
Really?
You think Wolf, do you know?
No, I didn't know.
I guess you're right, because I don't think I even knew that coming in.
Okay.
So that's a really good point.
So when you're having surgeries, not your implants aren't reused.
No.
Unless they're trialed and then re-sterilized.
Go ahead, tell it.
Okay.
Tell it, babe. Tell it.
So your surgical equipment, typically your scalpels, your scissors,
Yes.
your retractors.
Hemostats, right, retractors, all the good stuff. Those are reprocessed.
They're reprocessed. They have to go underneath a sterilization process.
Yes, for sure.
But they steam it. It looks like they put it in a
They
microwave.
put gas in it. They water it. Girl, it's a lot. It's not my field.
Yeah.
But, I mean, they say it's sterile. It's sterile,
So they sterilize it to remove bacteria,
for sure.
viruses,
Bioburdens, yes.
and human debris. I don't know if I can say human debris.
You can.
What
It's
can you
the
say?
truth.
Is that what you call it? Human debris?
It's human debris, bacteria,
Human
bioburden,
material.
biohazards. I don't know. All kind of stuff.
So it can be contaminated.
Yeah.
So it's your job to make
Mhm.
sure that there's no I guess,
Anything that I
soiled
see, right.
equipment, right?
Exactly. Exactly.
So that's one part of it. Then gowning up and
Oh,
draping,
yeah.
because I notice sometimes, very rarely, people
Yeah.
contaminate themselves, and
Yeah.
you're responsible for catching that
Exactly.
sometimes.
Even you, if you see it, because
Yeah,
we know we don't have eyes like for everyone, but yeah, if you see something, say something because it's for the patient.
yeah,
Please,
yeah.
people. Yeah.
So setting up. I
Yeah.
think the toughest part about being what do you think the
I
toughest
knew
part
what you were
about a
about to
surgical
say. Because you'd
technologist
be
is?
like, them trays are heavy as hell.
Two things. There's so what are you responsible for?
So we are responsible for the trays. I
Mhm.
mean, I'm responsible for the patient's safety as well.
Yeah.
And my tables and my mail, my back table
And setting up.
and setting up.
Yeah.
Yeah. Setting up for the entire like room. Yeah.
That's one part. The trays are super
Yeah.
heavy. And the other part is that you're standing for the whole surgery
Yeah. Depending on the surgery.
for the
Yeah.
most part.
For the most part, yeah.
So you could stand for
Yeah.
what's the longest case you think you've ever stood for?
Ooh. Well, where we worked at together, those are my longest cases. Now,
Really?
girl, I sit.
Really?
Life is good. But the longest I've done was like a spine case, I would say. A good 8 hours.
Standing.
Standing.
And you do get breaks.
You do get breaks in between. If you have to use the bathroom, if you need to eat, someone will come in and relieve you.
Okay.
Or sometimes even if you need to sit,
Okay.
they'll get you a stool and you can sit.
Okay.
Mm-hmm.
All right.
So it's not like you're being tortured, because I feel like that's a bad misconception about surgical tech. Oh, I don't want to do it because you guys stand too long. Yeah, but it depends on the case.
Yeah.
If you're doing carpal tunnels, you're gonna sit. If you're doing
like-
laparoscopic, you're gonna sit. If you're doing
And those cases-
robotics, you know what I mean?
Yeah, those
If you're
cases
doing
are
ortho,
fast.
obviously it's heavy stuff and more time you're spending on your feet. But when I'm traveling, we'll get into that. We'll get into that.
How did you? So you clearly there's a lot of instruments. All I know is like the
Yeah.
Kelly.
Who else you know? Alice.
The Kelly and the Alice. I don't even know what they look like.
Really?
So no, I don't. No, I don't. They're all
Well,
the
I
same
get
to
it.
me.
Well, yeah.
So you're responsible for knowing all the instruments, because it's not just
Yeah.
right. You got to know
Right.
your scalpel. And I think another thing is
Mhm.
knowing your surgeon and
Yeah.
knowing the surgery, so you know
Yes.
what to hand your
Yes.
surgeon.
Anticipation is really good.
Anticipation
Yeah,
of
for
what your
sure.
surgeon
Mhm.
is going to want. How do you feel
Mhm.
like the interaction is between you and the surgeons most of the
Mm.
time?
I'm like you.
Okay.
Like, people like me. I
Yeah.
don't know what it is. Like, I don't play. Like, I'm serious, but I'm also very nice and friendly.
Okay.
Like, and I get it. You don't know me. I don't know you, but we're here to do a job,
Yeah.
right? Like, so let's just keep it cordial, keep it cute, and that's it. Now, if they do get a little out of hand, then I act accordingly as well.
Because there are instances where, because surgeons, we're not going to sugarcoat it.
Yeah.
They have a reputation, a notorious reputation for being sometimes mean. Have you ever had a situation where you had to deal with someone who was
trying to
not
think
that
back.
kind with you? Probably not. I don't think
I'm
so.
trying to think back. In my first years, yeah, maybe because I was like a timid little shy little girl.
You gotta have confidence.
Yeah.
But with confidence only comes with experience, I feel
That's
like.
true too. And I will
Right.
always tell myself, like, Gina, don't take it personal.
Yeah, that's another thing.
Yeah,
Not
he
to-
yelled at you, he threw something on your table, breathe, you can talk to him after.
They do that.
If ever.
They do that.
But I feel like surgeons also now, like back in the day, that used to be a thing where surgeons would have attitudes, but I'm hearing now they have like to take anger management, and they can't act certain ways in certain institutions, or
Yeah.
they'll have like suspension, or I don't know.
It messes with their money.
Right. So I've come across a lot of nice ones. I
Okay.
really have.
So let's talk about pay real quick.
Okay.
Well, before we talk about pay, is there a test that you have to take once you're done
Yeah.
with school?
Mhm.
Can you talk to me about that?
Yeah, so you have to take the national boards, I think it
Okay.
is, after clinicals.
Okay.
Yeah, so
Is it a hard test? How many questions do you remember?
I would say it was about 130 questions. It wasn't hard.
Okay.
It's a lot of memorization.
Like
Yeah.
the instruments? Like, yeah, what's on? Is there
Exactly.
any anatomy or physiology?
There is.
There's
But
anatomy.
that's why you got to pay attention in school when you're in those for 6 months. When you're in the classes,
Okay.
you have to pay attention. So you can remember. It's easy though. It's just really memorization.
It's easy. I love that you say that.
It is, because I feel like if you just know the information, you study, you listen, you know how to comprehend well, you can get it. You can do it.
I think a lot of people struggle with being intimidated with entering certain spaces within medicine
Mhm.
because it appears as though it's
And
difficult.
maybe the terminology seems like
Yeah, but I love what you just said. It's like
you can
if you study,
comprehend.
you can do it. If you
You
can
really
study,
can.
you can really excel and do
Mhm.
well. It's not that
I believe
intimidating.
we can all literally do anything we want to,
Period.
honestly.
Period. I love
Truly.
that you said that too. You can
Thank
do
you.
anything. It doesn't even just have to be in medicine, but obviously this
Yeah.
is money power medicine.
Period.
So I'm focusing on
Okay.
different specialties in medicine.
Yeah.
I know people are gonna kill me. Like, you just don't have to be a doctor. You don't. No, that's how come Gina's here, because we're talking about being a
People.
surgical
That's
technologist.
right.
So you took the exam, you get a certification.
Yeah.
Does that allow you to practice all over the US, or is it like just state dependent?
That's exactly right. Yeah. With
Okay.
that certification, you are allowed to travel and work all over the US. It sucks that you can't outside of the US, like nurses. They get to like work outside of the country, whatever. But
Because you love to
love
travel. We'll
y'all.
talk about that later.
Right, true. Because that would be nice, right?
Yeah.
But yeah, anywhere in the US you can work.
What is it? I like that you just mentioned nurses, because I see nurses also scrubbing.
Oh yeah.
Can you tell me the difference
Yeah.
between a surgical technologist maybe and a nurse scrubbing? Because
Mhm.
they don't have to go to school to do that, right?
Right, but they do. Okay, so OR nurses, I'm hearing they're like required now to learn how to scrub. So if you want to be an OR nurse, you do have to learn how to scrub.
Do you think that's going to affect your pockets later down the line?
I don't know. I think that's a staffing issue. That's why they
Okay.
want nurses to scrub. Whenever like there's like not a tech around, like a nurse can just jump in and know what to do.
Okay.
Because outside of like large institutions, a lot of inner cities, like they don't have a lot of staff. So maybe that's why nurses
And you
have to learn how
left.
to scrub.
When you stopped.
I know, I left. It's all right. There's
One
money
thing
on the road, girl.
There's one thing that I would like to mention is, if you're already working in a
Mm.
hospital, sometimes they have programs where they will pay for you to go to school, like
Yeah.
to go to surgical technology school.
That's what happened to me, yeah.
Oh, they paid for you to go to school?
Oh yeah, for sure.
Oh, good.
Yeah, and then there was like a tuition reimbursement. So once you graduated, you would I'm sorry, no. There's like a loan that you can take out with the hospital that you're in. And then once you finish graduating, then you show them your certification and then they'll reimburse you your tuition.
So you didn't pay?
No, girl. Thank God.
That's good. That's what I'm saying.
I
There's
don't know
some
if that
money to
applies
get.
to every facility and institution, you know what I
Yeah.
mean? Yeah, I wish, but I know that's not for everyone.
No. But if you're already in the system, ask,
Yeah,
right?
exactly.
Now that you
Doesn't have to
know.
ask, yeah.
Okay. So you don't know if a nurse is gonna basically, I don't think so
I
either.
don't think so. They have so much to do inside the OR. Can you imagine them scrubbing and circulating at the same time?
No.
That's
They
too
can't
much.
do that.
They would be burned out. They're already burned out.
It's so
Love y'all.
funny
Love
'cause
nurses. Love all of y'all down.
Wolf just talked about being burnt out in
Yeah,
healthcare.
it's a thing.
Okay. So we were working
We'll get into that.
together
Yes.
and then you left.
I know I miss you down, girl. I miss you so much.
Why did you leave?
I wanted more.
You wanted more what?
More freedom, more experience.
Okay.
that was my first job.
Okay.
So I only had one specialty under my belt. I knew that
Which
in
is
order
ortho.
which is orthopedics, my baby, because it has taken me places. But yeah, I wanted more. I
More
needed more experience. I know if I needed to soar in this field, I needed to like
I love
leave.
that, soar. Because let's talk about it. You can make 6 figures
Mhm.
as a surgical technologist.
Facts.
And I think I looked it up. The highest paid surgical technologist is the cardiovascular
Yes,
surgical
girl.
technologist. And I'm just going to
CVOR.
drop the number. I saw
Yeah.
that they're making like 300,000
Girl,
a year.
that's
a
what
lot
I'm
of
trying to
money.
get into now.
That's a lot. Are they the highest paid surgical
because
technologists?
it's hard and they are super meticulous and there's like a heart team. Like,
Yeah.
you're on this team specifically. So yeah.
When I did my cardiovascular rotation as a medical student, I remember the surgeon only wanted to work with one surgical technologist.
Exactly.
Just one.
Because
And
when
this
it comes to the heart, they don't play.
The surgical technologist knew everything.
Exactly.
I think he could. I'm
could
not
do
going to
this-
say that he could have done the surgery, but he anticipated every single thing that this the cardiothoracic surgeon needed. But if you're not making 300,000, you can still make good money.
Absolutely.
What do you think the range is after graduating without having experience? What do they typically start out with?
Ooh, well, I've recently heard where we worked at, where I used to work at, they got like a increase in pay,
That's
like
good.
a 3% increase. So I don't know, but for me, when I started out, it was
You don't have to say what you made. You could say what you think.
what the range was.
Mhm.
Well, can I even say the state that we live?
No.
Dang. Okay. Well,
Too many haters.
Okay. The range. We'll cut that out. Okay. So the range I would say is from 65 to about 80 starting out.
That's good.
Yeah.
That's good.
Mhm.
For 16, 18 months to 24
Exactly.
months, if you
Mhm.
can go to school for free, 65 to 80 without experience, not too much schooling.
Yeah, right?
But then you left because you wanted to make more,
I did.
and you're making more.
Yeah,
You left a little bit after the pandemic?
I did. Yep.
Okay. So
2021.
can you talk about what you started doing and how you set it up? Like,
Mm.
like what made you leave? How did you know to get into?
Do you really want me to give you the tea on why I leave, or
Give
you
me
want
the
me to
tea.
keep it cute?
Keep it cute.
Keep it cute? Okay, we're gonna keep it
Oh,
cute.
give me the tea. Do you want to talk about the tea?
Ooh, we'll
Give me
keep it
the tea.
cute.
Give me the tea. Now viewers are gonna want to know what the tea is. What's the tea?
The tea, I was being harassed.
What do you mean?
I was being harassed at my old hospital that I was working at. So that's why I really
No.
truly left. I wanted to become a traveler, but not that early.
What do
But
you mean
that
by harassed?
situation by a colleague. I was being harassed by a colleague.
I think I remember.
That's really why I left.
But he got fired.
Yeah. We could cut that out too, but yeah, that's really why I left.
I didn't know that.
Really? You didn't know that? That pushed me out for real. Like, I was like, I can't. Because of retaliation of him after he got fired, like, it was like,
Retaliation by other people?
girl, I left. Yes. They were retaliating against me, honey.
What?
Girl, yes.
That's what I'm saying. Medicine could be messy.
Mm-hmm.
I'm sorry you went
It's
through that.
okay. But look at where I'm at now.
Yeah, better.
Seriously.
One door closes, a better door opens.
That's how I see it.
So I'm sorry. I should have just kept it cute. Oh, because now I feel so bad.
No,
okay.
it's okay. It's okay. I talk about that all the time in my community.
Okay. So you left. You got a better opportunity.
Yeah.
And basically thrive.
I'm thriving.
So how did you know to start doing locums or travel surgical technology?
So I started looking. I knew nurses could travel.
Okay.
So I was like, okay, let me see if surgical techs can travel.
So nobody told you about it?
No one told me about it. That's so funny. Yeah. So I looked it up myself, and then I started asking around. Like, have you ever heard any travel surgical techs? And people actually knew a lot of them. And so they're like, yeah, they're making like $3,000-$4,000 a week. I'm like, okay. So I started doing my research, applying to agencies, talking to different recruiters, and I took my first step once I signed that contract. Prayed and did it.
So you have a book. Where's your book?
Well, since you asked.
Because we're going to talk about it now.
This is my book.
Where's the camera we're looking at? So what is your book called?
It's called A Surgical Technologist Guide, 6 Steps to 6 Figures. And it's literally a breakdown on how I became a traveling surgical technologist.
Let's talk about it. So let's get into it. So you still got to get the book. So we're not going to get too many details.
Too much,
but what do you essentially need to do in order to become a traveling surgical technologist?
Okay. Well, first you need to become a surgical technologist.
Yes, that's number one.
So that's in the book as well, because this book is also for people that don't know what career path to take.
Yeah.
Right? Because after high school, sometimes it's a little tough. You don't know what you want to do in college. Like me, I didn't know what I wanted to do with college. I have a degree that I'm not using, right?
Yeah.
So this is also for you, for people that don't know what they want to do with their life just yet. So first you have to become a surgical technologist, at least get about 1 year or 2 of experience, and then you can travel. That's all I'm going to say.
Okay. That's it. That's all we're giving you.
That's it.
So you started traveling and you set it up in a way that your schedule looks.
Oh yeah.
Like I'm jealous.
No, you can't be, babe.
I'm jealous. Because you're always on the beach. You're always traveling. You're always having a good time. You look good. Your body looks good. You look healthy. Your skin looks good.
I can't with these compliments, y'all. She always.
Like, so let's talk about it. How many days a week are you working?
Well, right now I'm unemployed on purpose. Stop. On purpose, guys. I took a month off.
Why?
Because I finished my contract, and I stayed with this hospital for 1 year. I kept extending my contract with this hospital.
It was a good hospital.
It was a good hospital. They kept increasing the pay, so I kept staying.
Good.
So I was like, okay, once I hit my year mark, I need to take a month off. So that's what I did. Yeah.
So you took so what's going to be the next step?
I'm going to go back in 2 weeks to that same exact hospital
for
one last contract.
For 3, and the contracts are typically 3 months.
Yeah, like
and I think that's
weeks.
Like standard.
Yeah.
If you're a travel nurse, I think it's 3 months. If you're an anesthesiologist doing locums, it's typically 3-month contract.
Exactly.
Do you need your own malpractice insurance?
That depends if you are 1099.
Are you 1099?
I'm both actually now. Yeah.
What do you mean by that?
You're both, and I'm also a traveler on contract.
Okay,
right?
So per diem means what?
Per diem meaning as needed. You can pick up a shift at any facility. On I don't want to say the website.
As long as you're like credentialed there.
As long as you're credentialed, yeah, you can definitely pick up a shift as needed. Like 3 hour, 4 hour, 6 hour shift, and they'll pay you for that day.
When you're per diem, do they cover your malpractice insurance?
No.
Okay. When you're per diem, are you paid 1099 or you paid W-2?
1099.
1099.
Yeah.
Okay. And what's the other way to do this?
The other way to do it?
Yeah, besides being per diem.
Oh, so you can just have a contract like I'm also doing as well.
Okay.
And that's W-2.
Okay, so contract is W-2.
And per diem is 1099.
Who covers your malpractice? Is there malpractice? Do you need malpractice?
I don't think I need malpractice.
Okay, it's probably the hospital covering that.
Yeah.
Nurses need malpractice insurance. So that's a good thing. What about health insurance?
Health insurance you would have to do on your own if you're 1099 contract. But again, I do both.
So you're getting your health coverage through
my agency.
Your agency, which is not per diem.
Right.
It's the contract.
It's the contract.
Ah, good.
Yeah.
So you need to contact the agency.
I don't know what that's gonna look like next year when I file for my taxes, but we'll see.
I have a good accountant now.
Okay.
My accountant last time was horrible.
Really?
But I have a very good one.
Hook me up.
I think he's Nigerian.
Yes.
Okay. So you basically make your own schedule.
Exactly.
That's the thing that you wanted, was some flexibility with your job, right?
Yeah, for sure.
So how many days a week were you working when you were on contract for the 3-month contract?
3 days a week.
You know, I am so jealous of y'all. The CRNAs working 3 days a week. It's like sometimes I look back, I'm like, why didn't anybody tell me about becoming a CRNA? But that's another episode. What happened?
They have travel anesthesiologists.
They do. I have my friend who comes on, Dr. Robertson, who's a travel anesthesiologist. We talk about that a little bit. I think I just got complacent.
Yeah. Yeah.
But I also have a daughter.
So?
Girl.
What?
I think let's talk about the drawbacks. The drawbacks of being a traveler or doing locums to me is that you really have to go all over or go kind of further away. Right? What do you think about that?
Because they do have local contracts as well, local travel contracts, and then they have the further ones. But the further ones do pay more.
They pay more. So I'm saying I will be away from my daughter. So that makes it a little bit,
Yeah, that's true.
And the good thing about my institution is even though I'm not working 3 days a week, I am typically off all weekends. Right? I'm very rarely on call on the weekends. So it kind of balances out.
Okay. And how often do you stay late? Oh, really? Okay. All right.
It could be.
She's getting to it, y'all.
But it could. But this is not an interview on me. This is an interview on you. So the good thing about what you do is that you can do shift work. Yeah. So how many hours are you typically working when you're working a 3-day-a-week shift?
12 hours.
That's good. So 36 hours.
36 hours. Not even working a 40-hour week. And I get paid double the amount what I would have got paid within that 2 weeks, that biweekly pay, because we do get paid weekly.
Okay.
So it's literally double the amount of that biweekly pay.
As opposed to being like a W-2? What do you mean?
Right, or like a staff employee. Or if I were to stay at the hospital that I met you at, I would have been getting paid every 2 weeks.
In half.
Oof. Isn't that crazy?
How do you feel like, I know we don't have a crystal ball, but is there still a market? Right? Because I know during COVID, a lot of people left their state to do travel. They left to, what's the word I'm looking for? They left to be travel medical providers. Yeah. Right? Nurses, doctors, not even just anesthesiologists. It was very lucrative to go to different places that had a real need. But now that COVID is over, it's 4 years later. Do you feel like there's a need? I know nursing has kind of dried up a little bit, like nursing contracts. They're not as lucrative as they used to be. Yeah. What about surgical technologists?
They're not as lucrative as they used to be because it was a pandemic, right? Okay. Like that's why they were in need, literally. I would say it's still pretty lucrative though.
Okay, so the job market is good. So if somebody were to enter school now, would you say in 2 years they would still have a good opportunity to find a job? How's the job market?
I was reading, what was it, Forbes or something? I was reading an article and they were saying like in the next 5 years, the percentage of surgical technologists what was it? I think surgical technologists will increase in jobs by 7% or something.
Oh, that's good. Like so the job market potential
4 or 5 years.
Okay, sorry.
Yeah, so the job
Can you
market
repeat that because I kind of cut you off?
It's okay.
Say it again.
The job market potential is good. So they said in a couple of years, like surgical tech jobs will be increased by 7%. So they need us. They need us in surgery. Yeah. We're not going anywhere.
I think in medicine.
Or in medicine.
Right. In medicine in general.
Right.
I think you just have to, that's how come we're talking about this. Because I think a lot of people do not have exposure to different specialties in medicine. And I think being a surgical technologist is a great field to go into.
I agree. I truly do agree.
Do you feel stressed being a surgical technologist? Is there a lot of pressure?
No.
Good.
I would say the pressure, because I'm a traveler now, would be what do they have? Like, what supplies do they have? Like, these are my problems now, like in hospitals. Like, do they have certain supplies? Like, is the nurse going to be helpful? Do I have to get everything except, or like, because, some nurses are helpful, some nurses aren't.
I see that.
So these are the things that I deal with. Like, who's who? Because I don't know anyone. I'm a traveler. I'm going into these places fresh.
So you got to be personable
So
to be a traveler.
Those are my issues now.
I think that's with anybody. Like, if you're doing travel assignments, like you gotta have some personality. You gotta be personable. You gotta, be a good judge of character to see who's helpful, right? Because you can't do this on your own. And despite what people think,
because you are a part of a team, right?
Yeah,
but it doesn't feel like that sometimes.
Sometimes it doesn't. That's what I was gonna lead into. Like, I think people have this misconception that everybody's super friendly and fuzzy and warm, and that's just not true in medicine.
Sometimes you could be in the OR and like everyone's quiet, but everyone's doing what they have to do, right?
That's the most important thing.
And that's cool with me too. Like, let's get it done.
That's the most important thing, is that as long as the job is getting done appropriately. But if you need help, right? I don't like when I hear people giving each other a hard time, because it's like, we're here for one purpose, right?
For the patient.
Yeah, because they could be on both ends.
Yeah.
You could have a mean surgical technologist.
Yeah, that's true.
Or you could have a mean nurse.
Yeah, it depends on the person, right?
It really depends. That's the team.
You can have a mean anesthesiologist. Not you.
That's true.
But everyone can be mean.
Yeah. So how do you deal with that, do you think?
I don't.
What do you mean you don't?
I don't deal. I don't have to.
I have to.
I don't have to. This is all temporary for me. That's why I love being
okay, let's talk about it. Is that mindset? Even if they're being mean, it's like, that's not my problem.
It's not my problem. I am not staff here.
Okay.
This is something that you guys have been dealing with and probably still going to be dealing with when I leave.
What do you mean by that?
Just like hospital drama or like whatever internal issues they have with one another. It's not my problem.
But you see
it. Great. But I see it. I get to watch.
Like,
oh, that's shady, but I'm here for 2 more weeks, so what do I care? You know what I mean? Like, I don't care. I love that.
So let's see. So what are going to be the next steps for you to progress in your career? How do you progress? How do you change to become, I think your goal is to be a cardiothoracic surgical technologist. Sure. What's going to be the next step for you?
/ a real estate agent.
Did you get your real estate license?
I'm going back to school to finish it. Okay. Remember, I stopped because of that whole debacle.
I'm sorry.
I became a traveler. It's okay because that was a blessing. But now I'm back on it. So yeah, I do want to get my CVOR, but I feel like that's pretty hard because I don't know.
Let's not say that. It's not hard. Continue.
Maybe it will be a little difficult.
No, that's not even the word. What do you have to do?
I'm not sure how to get into it because the heart is so serious. And I don't think, okay, for instance, when you're in school, you get to go in and shadow in any OR you want, right? But when it comes to the heart, you don't get to, there's no shadowing when it comes to that, right? Like,
so how are you going to do that
that's
then?
what I'm trying to figure out.
Would you have to, do you have to shadow?
School? Like, I don't know any cardiovascular surgeons. I don't know any cardiovascular surgical techs that I can ask these questions.
So if you're watching this and you know a cardiovascular surgical technologist.
How can I get into getting a CVOR certification? Please.
You need the certificate.
I think so.
Oh, we need to do some research.
Some more research.
So if you are a cardiovascular surgical technologist, please hit us up. Can you tell, is there something that you wanted to say while you're on this episode that we didn't get to?
To purchase my book.
How can they find you, Gina?
You can find me on Instagram at CST Travel Guru. Wait, which camera am I looking at? This one? This one. Okay. You can find me on Instagram at CST Travel Guru. You can find my book on Amazon. The link is in my bio. You can find me on TikTok as well. All that stuff is in my bio. So CST Travel Guru on Instagram.
Thank you so much for coming.
Thank you for having me.
You did a great job.
Thank you. You sure?
Of course. Give me hugs.
Of course. I love you. Thank you for having me.
I love you too.